You're watching Channel 4, the local station. Live with Mary Bear, Kent Justice, the Weather Authority forecast with Chief Meteorologist John Gahn, sports analysis with Mark Brunell, and breaking news with Sky 4. The 10 o'clock news continues.
136 cases now in every Northeast Florida county except Union County. That's where we stand tonight as coronavirus spreads. There are now 50 cases in Duval County. No new cases since this time last night. 24 cases in St. John's. That's up 2 from yesterday, and 10 cases in Clay County. Statewide, there are more than 1,400 cases in Florida, including nearly 90 non-residents. 20 people have died so far in the state, including 3 in Duval, 1 in St. John's, and 2 in Clay County. Mayor Lenny Curry of Jacksonville says that he's keeping a close eye on hospital admissions data from COVID-19. He says that those patients would be severe to critical.
And News4JAX I-Team investigator Kelly Wiley is digging into the data of how many patients hospitals can hold and what some experts project could happen without an order for people to shelter in place.
Preparation has begun for a 250-bed ICU field hospital in Jacksonville. The mayor says the facility is a precaution in case hospitals become overwhelmed with coronavirus patients.
Our hospitals are in good shape. This is an asset we will have in our region to use if needed. The goal is to prevent the circumstances we're seeing in other countries, where hospitals are full and critical needs patients are going without the care they need because of the lack of resources.
A group of data scientists who put together the site covidactnow.org created a model showing how many people might need to be hospitalized depending on what actions government officials take. According to their calculations, in the state of Florida, if no action is taken, the number of people needing hospitalization would peak on April 24th, with nearly 500,000 people statewide. With 3 months of social distancing, that peak is delayed to May 14th, and it peaks lower, under 200,000 hospitalizations. But if the state put in a shelter-in-place order, like some have done, and kept it for 3 months, at the end of the model's projections in July, there would be just 18,000 hospitalizations. The group behind the model emphasizes they're not predicting the actual number of cases in the future, just showing what could happen to help make decision-making efforts. Some of these numbers are even more staggering when you look at the number of hospital beds in the state. According to an Associated Press analysis of federal data, there are only about 48,000 beds in the state, and they're generally 63% full. And when you consider that some COVID-19 patients need intensive care, there are just under 4,600 intensive care beds in Florida, and those are generally 67% full. Several Florida senators, including Orlando Senator Victor Torres, are calling for the governor to issue a statewide stay-at-home order to prevent more people from getting sick and alleviate pressure on hospitals.
Throughout the state, certain counties are doing the same thing. They don't want to spread this virus anymore than it needs to, and make sure that our constituents are safe.
Kelly Wiley, Channel 4, the local station.